Hi Pragnya, I'm really happy to meet you on this Sunday. Like we have అందరూకి కన్ఫ్యూజన్ ఉండొచ్చు మన ఇద్దరి కనెక్షన్ ఏంటి అనేది. We did our PG together in Ramchandra and here I'm overwhelmed you being the female woman breast oncoplastic surgeon. How is it, Pragnya?
It's been a long journey, Shruti. And first of all, let me tell you, as excited as you are to be doing this, you know, it's interesting to see how we start off and then where we land and then the future ahead.
I know. For people who don't know us, we both did our post-graduation from prestigious Ramchandra College from Chennai. I really wanted to, I feel really proud that I did it because all my love for obstetrics or infertility is from there. Like at any time, if you ask me, will you choose this institution? 100% yes.
It was our base and we shouldn't take any credit away from it.
I know.
We had a lot of fun, we learnt a lot, and that's what it
You all we are all like, your colleagues, your friend gang was there. Nice. I hope everyone is happy in their own lives.
Yeah. Everyone's set in their own careers, so
I know.
That's been good. But నీ క్వశ్చన్కి అయితే బ్రెస్ట్ ఆంకోప్లాస్టిక్ సర్జరీ అంటే ఎందుకు స్టార్ట్ చేసిందంటే ఇట్ స్టార్టెడ్ యాక్చువల్లీ ఇన్ రామచంద్ర ఇట్ సెల్ఫ్. జనరల్ సర్జరీ చేసేటప్పుడు ఎందుకు there was an inclination towards
because
surgeries.
When you started there were not many female surgeons. Like surgery itself is like they think it's a man's
నన్ను కూడా చాలా మంది వెళ్ళొద్దన్నారు, ఇంక్లూడింగ్ మై ఓన్ తాతయ్య హూ వాజ్ అ జనరల్ సర్జన్. వెళ్ళొద్దు
females being the surgeons at that time, like not much time long ago, but still for the woman to
get into that field. కానీ దాని తర్వాత I think it just was a natural course once you're interested in breast. And breast అనేది it's so niche కదా, మొత్తం ఫినిష్ చేసిన తర్వాత you need to start treating patients, and I just went with the flow, finished all that, and there was a little bit of a family dynamic going on in terms of why I did this field. So breast and it's so connected with gynecology. And most of the patients, women, mee dagarke vastaru first ga. So before I go any further, she's Dr. Sruthi Muvva. I'm officially introducing her. She is an obstetrician and fertility specialist, and what I am very proud of is where you've reached and what you're doing currently. So congratulations on that. And before this looks like a praise and praise podcast, let's begin.
I know.
So Shruti, I was thinking about this for the past few days, and clinic lo manaki chaala mandi mutual patients vastarante, like not exchanging per se, కానీ similar type of patients వస్తారు because my field goes to you and automatically మీ దగ్గరకు వచ్చే వాళ్ళు and like they come with breast symptoms, right? So first off, two different fields. Yes, we do a bit of each other's field as well because we are doctors at the end of the day. కానీ నాకు చాలా మంది చాలా క్వశ్చన్స్ అడుగుతూ ఉంటారు గైనకాలజీలో, and I send them to a gynecologist because ultimately that is the expert opinion.
You can direct them. You can suggest them and direct.
Absolutely. So I'm just going to ask you a few questions that people ask me, and people come to me with symptoms because anni correlate ayi untai kada. So PCOS anidi, that's the most commonly asked question. Chaala mandi come with irregular cycles and that is connected to the breast. Papam valaki unfortunately some people develop avavu, some people oversize outai, chaala noppiga untai.
When it comes to that, Pragnya, like do you see young girls like who feel underconfident about the size of the breast?
They come to me with A cup breasts or smaller, and they like,
how do you treat them? Like how do you even handle the situation?
They feel underconfident, but all that I can tell them is I look at their body habitus kada. Andariki వేరే వేరే రకమైన బాడీ హ్యాబిట్స్ ఉంటాయి, అండ్ అన్ఫార్చునేట్లీ మన దగ్గర మందులు లేవు, మందులు ఇచ్చి బ్రెస్ట్ సైజ్ ఇంక్రీజ్ చేసేదానికి. సో వాట్ ఐ డూ ఇస్ ఐ డూ టాక్ టు దెమ్ అండ్ ఫస్ట్ reassure them that breast size is necessarily not a sign of confidence. It depends on your body type. And but irrespective, ultimately people's confidence kanaka baga under confident aina alanti issues vaste surgical augmentation, cosmetic augmentation is something I offer to them with implants.
So there are no creams, no injections, not even the diet that can increase the size of the breast. How do you brutally tell that to a young girl?
Honestly, I'm very honest with them.
Oh yeah, you should.
ఇవి లేవు, ఇది మీ బాడీ టైప్. బట్ దెన్ అది ఇట్స్ ఓన్లీ ఇఫ్ దేర్ ఇన్ ద 20s అండ్ మొత్తం డెవలప్మెంట్ అయిపోయిన తర్వాత అప్ టిల్ 16-17 అలా ఏజ్ లో వస్తే ఐ ఆస్క్ దెమ్ టు వెయిట్, బికాస్ 16-17 తర్వాత కూడా సడన్ గా పెరగచ్చు కదా. సో ఇట్ డిపెండ్స్ ఆన్ ద ఏజ్ అండ్ యూ షుడ్ బి ఆనెస్ట్ విత్ దెమ్. రియల్లీ ఇఫ్ ఇట్స్ బాదరింగ్ యూ, then there are surgical options. Unfortunately, it's only surgical options. And meera adiginatka, I'm sure you also get this question a lot.
I get, and you wouldn't believe I recently faced a situation. Ella ante marriage anedi settle ayindi. They were engaged and all, the boy and the girl. But suddenly the boy wants to cancel the marriage. And you don't believe the reason is the woman is having smaller breasts. That day I was so disturbed in the OP. Until the entire value of woman has come down to just the size of the breast. Mementa counseling ichina, that boy was very clear that he doesn't want to marry her, in spite of giving extensive counseling. Do you know, how do you feel? What is the situation of the girl then?
Can't really help it, like you said.
Ide ante anta asal because of that man, my situation enti, I was helpless in that situation. But again I thought, okay, at least he was clear before marriage, and what if this happened after marriage?
And pertaining to that, నాకు చాలా మంది కేసెస్ వస్తారు, యంగ్ బ్రెస్ట్ క్యాన్సర్స్, రైట్? పెళ్ళి జస్ట్ 1 year అయింది అండ్ దెన్ లంప్తో వస్తారు అండ్ ఇట్స్ బ్రెస్ట్ క్యాన్సర్. డ్యూరింగ్ ద ట్రీట్మెంట్ ఎన్ని చేంజెస్ అవుతాయి అంటే బాడీలో, అల్టిమేట్లీ ద హస్బెండ్ లీవ్స్ ద వైఫ్. And that's even worse a situation for me, because పెళ్ళి అయిన ముందైతే at least, like you said, it's okay, you can move on. But what about this situation where they don't know what to do, and most of these women are old fashioned and it's not like they can move forward that easily.
I know.
So there are many situations like that unfortunately we can't do anything except reassure them.
I think we being the millennial doctors, we are bonding the two generations. Like it is really difficult to handle that, and that day I was a very helpless situation, and still it does haunt me. But I know the younger generation should see women as a whole, isn't it? It just doesn't have to come to a part of her body.
Well, hopefully that's a point that younger men take from this conversation. So indaka,
but atla no okay, Pragnya, but after delivery, after having multiple births, and a woman ane vallu me child ni ivvadaniki, she's going through the entire body shift. But then I see women coming to my OPD and saying that her breasts are saggy and the husband is not interested in her, he's having an affair. How is it even?
It's just unfortunate events. These are all just very, very unfortunate events.
And we being in the helpless situation, I can't just say we don't have options.
But having said that, there are options.
Yeah.
Breast sagging ki, we just wait until breastfeeding etc. is over, and when they're ready to be completely out of that cycle, breast mastopexy and surgical options unnai. There are options that we do give women.
Yeah.
But unfortunately indaka mee cheppinatka medicines lantivi edi undadu.
And for the surgery she has to be financially independent, and the husband is not going to support that as well. How many you think
can go through?
I think the medicine should evolve into that, maybe
into changing husbands' mentalities. I don't think that's going to happen anytime soon.
No, but I think some magical medicine that I feel I can help those women with.
Well, today with functional medicine and so many new things coming up, you never know what the future holds for us. But indaka manam maatladukunedi PCOS.
Oh yeah,
right?
PCO.
That's a question that haunts me in the clinic. Women వస్తారు.
Actually PCO అనేది it is called PCOM అన్నమాట. అంటే మనం ఓవరీస్ ని స్కాన్ చేసినప్పుడు there are lot many follicles than usual. The volume కూడా ఎక్కువ ఉంటుంది. So the ovaries are creating more follicles. ఇది ఎప్పటి నుంచో ఎన్నో జనరేషన్స్ నుంచి ఉన్నది. బట్ యూ వోంట్ బిలీవ్ దిస్ ఇస్ మైటోకాండ్రియల్ ట్రాన్స్మిషన్. అంటే ఈ గర్ల్ వాళ్ళ మదర్ ఊంలో ఉన్నప్పుడే మదర్ మైటోకాండ్రియా నుంచి ఈ బేబీకి వస్తాయి అన్నమాట. అంటే ఇఫ్ యూ స్కాన్ ద PCO ఉన్న వాళ్ళ మదర్ని కానీ సిస్టర్ని కానీ స్కాన్ చేస్తే దే విల్ హ్యావ్ PCO, బట్ ఇట్ డజంట్ హ్యావ్ టు మేనిఫెస్ట్ బికాస్ అక్కడే ఎపిజెనెటిక్ ఫ్యాక్టర్స్ అన్నమాట. మనం తింటున్న తిండి, ఉండే our dietary habits, manam chese exercise, mana stress levels will come into place, and that's how it manifests, like irregular periods, acne, and a lot many excess hair, weight gain, hair idi.
So how do you counsel them?
It's PCO is like the most common problem. Okappati census is like 6 to 7 out of 10 women. Now 8 to 9 out of 10 women are diagnosed with PCO. PCO అంటే ovarian morphology definitely గా ఉంటుంది. And in the future 10 out of 10 women are gonna have PCO. ఇక PCO లేని ఆడపిల్లల్ని చూడలేం. సమ్టైమ్స్ ఐ గెట్ యంగర్ ఉమెన్ ఊరికే ఇర్రెగ్యులర్ పీరియడ్స్ అని ఉంటారు కదా, ఇంకా మ్యారేజ్ కూడా అవ్వదు వాళ్ళకి, సో వాళ్ళు స్కాన్ చేస్తే PCO అని ఉంటుంది. అండ్ ఓకే, ఇర్రెగ్యులర్ పీరియడ్స్ గురించి కౌన్సిలింగ్ ఇస్తాం మనం, బట్ దెన్ నెక్స్ట్ క్వశ్చన్ ఇస్ మా అమ్మాయికి పిల్లలు పుట్టరా, మ్యారేజ్ చేయాలి, చెప్పాలా అని. దెన్ ఐ ఓన్లీ సే వన్ థింగ్, అమ్మ ఇలా PCO లేని ఆడపిల్లల్ని మేము చేసుకోము అంటే ప్రపంచంలో ఎవ్వరికీ మ్యారేజెస్ అవ్వవు అని. సో దట్స్ హౌ ఐ యామ్. సో జస్ట్ రిలాక్స్, ఇట్ ఈస్ ద మోస్ట్ కామన్ కండిషన్. అండ్ కొంచెం ఈ లైఫ్ స్టైల్ కనుక చేంజ్ చేసుకుంటే ఇట్ షుడెంట్ బి ఎ ప్రాబ్లమ్ ఎట్ ఆల్.
That is the exact same thing I tell patients, younger ones who come to me with breast pain. తగ్గట్లేదు ఇది అది అని. I keep telling them only one thing, exercise. Get some exercise into your routine, like you said, lifestyle modifications, eat a good diet. Half the issues get solved with that. Forget being healthy, all your symptoms will come down if you follow such basic things.
కానీ లైఫ్ స్టైల్ చేంజ్ చేసుకోవడమే కష్టం కదా.
కష్టమే, but somewhere you have to make the effort.
I know, so many resolutions I made, but that doesn't happen. So we all do. I know.
But in that, you know how you mentioned a point where pill avutundi husband, families cheppala din gurinchi. The other thing that I face in the clinic similar to that are breast lumps. Completely non-cancerous benign breast lumps వచ్చినప్పుడు ఎంత చిన్న సైజ్ గా ఉన్నా కొన్ని వాటికి like fibroadenomas అని ఉంటాయి. You don't have to touch them. You don't have to touch them, you just have to wait, and sometimes చిన్నవి అవుతాయి. అది మన లైఫ్ స్టైల్ ని బట్టి. కానీ ఒక సైజ్ ఉన్నప్పుడు అరౌండ్ 3 centimeters తీసేసేయాలి.
3 centimeters is
around
the
3
cutoff
centimeters
for any fibroadenoma. So having said that, చాలా మంది వస్తారు పెళ్లి కాక ముందరే because of those lumps, fibroadenoma. నేను ఎన్ని సార్లు చెప్పినా అమ్మ అదేం కాదు, జస్ట్ కీప్ ఎగ్జామినింగ్, మీరు జస్ట్ అట్లా ఎగ్జామిన్ చేసుకోండి రోజు, అది మంచిగా మూవ్ అవుతున్న రోజులు ఏం కాదు, పెరిగాక చేయించుకుందాం అంటే దే హ్యావ్ దట్ ఫోబియా అన్నమాట. సంథింగ్ ఇస్ దేర్, గడ్డ ఉంటే ఇవిడేంటి వెయిట్ చేయమంటున్నారు అని. బట్ దే డోంట్ నో దే కెన్ రికర్.
ఎగ్జాక్ట్లీ, రెకరెన్స్ కాకపోయినా వేరే బ్రెస్ట్ లో వేరే సైజ్ ఎక్కడైనా రావచ్చు.
అదే.
సో ఐ థింక్ యూర్ రైట్ ఆన్ ద ఫ్యాక్ట్ దట్ యూ షుడ్ కౌన్సిల్ దెమ్. సరిగ్గా తినడం, ఎక్సర్సైజ్ చేయడం, ఇవన్నీ ఫాలో అయితే అల్టిమేట్లీ వీ కెన్ సార్ట్ దిస్ అవుట్. బట్ లైక్ యూ అగైన్ మెన్షన్, సైజ్ కనుక పెరుగుతున్నట్టుంటే గెట్ ఇట్ అవుట్ ఇమీడియట్లీ బికాస్ సమ్టైమ్స్ చూసుకోకుండా ఉంటారు. చూసుకోకుండా 3 centimeters కనుక 5 అయ్యి 5 కనుక 8 centimeters అయ్యి ఇట్స్ అ డిజాస్టర్ అగైన్. అండ్ మోస్ట్ ఆఫ్ దీస్ మదర్స్, I obviously I'm not undermining any mother, but I had a patient ochin 3 centimeter lump tho, and unfortunately she had kids to take care of.
Okay.
Very very benign disease. Happily తీసేస్తే వెళ్ళిపోవచ్చుగా, పిల్లల్ని చూసుకోవాలని she didn't come for 8 months. That turned out to be a 20 centimeter lump.
Okay.
And now unfortunately
it's not non-cancerous.
No, it's not cancerous. It's still the same, but 20 centimeters now I have to do a mastectomy for her. They మొత్తం తీసేసేయాల్సి వస్తుంది. So I think women really have to focus on themselves.
Asala I think women every day, it's not the face. Vallu mirror lo chuskovalsindi face gaadu. It's more important than face. I feel it's a breast anamata. 2 years back I made a video regarding the breast, the most common, but I see a lot many comments anamata. How can you speak about breasts? How can you openly say that they need to take care of that? I was so shocked. అంటే ఇంట్లో ఉండే ప్రతి ఉమెన్, మదర్, సిస్టర్, వైఫ్, అండ్ దట్స్ ద మోస్ట్ ఇంపార్టెంట్ ఆర్గన్. స్పీకింగ్ అబౌట్ దాట్, స్టిల్ దేర్ ఆర్ మెన్ నాట్ ఫీలింగ్, they feel so awkward.
It's a taboo, it's a cultural thing unfortunately, but whoever would watch this should know that breast cancers are the most common cancers in this country today.
Yeah.
And unfortunately, every 13 minutes, one woman is dying from breast cancer.
Pragnya, of late, what do you feel like? Is there any increasing trend in the breast cancer?
Yeah, according to the recent data, I think 22-23 data, manaki average age is no longer 45. You know, manaki most of the women that I see in my clinic also, around 35, 32, and so many young mothers, unfortunately. Nena age చూడట్లేదు 50s, 60s anymore.
Yeah.
And అందరూ early stages లో వస్తున్నారా అంటే అది కూడా కాదు.
Oh, even with so much of awareness
Education,
programs,
awareness,
early
everything.
detection.
Yeah. Manam rural India doesn't know about all this anukuntam kani mana educated urban women also don't really take care of themselves. And that is the issue here, unfortunately. Cancer పక్కన పెడితే క్లినిక్ లో ఫైబ్రోఅడినోమాస్, ఫిల్లోడ్స్ ట్యూమర్ మనం చాలా చూస్తాం కదా, అవి కూడా పెరుగుతున్నాయి. And I'm just so surprised that we're seeing so many phyllodes tumor. Theory అయితే రేర్ అంటారు కానీ it's no longer rare.
That's because of estrogen dominance kada, and that comes from the obesity.
Possibly.
And lifestyle. How many of us exercise, like in general? How many?
I do, but
I do, but yeah.
But that's true. It's true. Generally, especially COVID tarvata, things have changed tremendously, and lifestyle really has to be focused on. But you know, the other common question that you can probably answer to everybody, again, second common case that comes to me. నేను IVF కి వెళ్తున్నాను. I've already had 3 rounds of IVF. నాకు breast lump ఉంది. It was a clear-cut fibroadenoma. లేకపోతే do I have an increased chance of breast cancer in the future?
Yeah.
Right? Now, what exactly do you do in IVF?
IVF, what exactly we want is multiple follicles, so that the chance of her getting pregnant is more. మనకి మంచి, సో దట్ సెలెక్షన్ కూడా బాగుంటుంది. ఎక్కువ oocytes వచ్చినాయి అనుకోండి, ఎక్కువ ఎంబ్రియోస్ వస్తాయి, సో వీ కెన్ సెలెక్ట్ ద బెస్ట్ ఆఫ్ ద బెస్ట్. సో ఫర్ దాట్ వీ విల్ డూ సూపర్ ఓవులేషన్ అనమాట, ఇన్ ద ఫార్మ్ ఆఫ్ ఇంజెక్షన్స్. జస్ట్ the hormones which mimic a lot more times natural hormones that are usually produced in the body, but they are given externally ga bite nunchi istam. So ఈ ఒక కామన్ మిస్కన్సెప్షన్ ఏంటంటే IVF అంటే క్యాన్సర్, లేదా IVF ఎక్కువ సార్లు చేయించుకోకూడదు, ఇట్ కాజెస్ క్యాన్సర్. బట్ recent research data, recent studies and all says there is no limit for how many cycles you can do it. But again, మీరు IVF specialist కాబట్టి మీరు ఎన్నిసార్లు అన్నా చేయించుకుంటారా మా బాడీ అనేది కూడా ఇట్స్ రైట్. ఇఫ్ యూ ఆర్ ఫిజికల్లీ, ఎమోషనల్లీ, సైకలాజికల్ అండ్ ఫైనాన్షియల్లీ ఓకే, దెర్ ఇస్ నో లిమిట్ ఫర్ హౌ మెనీ టైమ్స్ ఇట్ కెన్ బి డన్. బట్ ఇక్కడ IVF వల్ల it doesn't increase your chance of getting the cancer, but there are certain conditions like endometriosis. For what is the purpose we are doing the IVF? When you are diagnosed with endometriosis, there is a slight chance of you getting carcinoma.
Okay.
A very, very rare chance. So
I agree with you.
IVF and cancer, I don't think so.
Yeah, I agree with you. Breast cancer ki IVF ki there's no direct correlation, but increased number of cycles, maybe there is a relative risk koncham which is higher.
Okay.
Like multiple cycles.
Yeah, that's
like you said, multiple cycles.
Yeah.
But most of them 3 cycles, 4 cycles.
Yeah.
Generally, we don't have studies that show that. The other cases, similarly, IVF lo fibroadenomas unna ma దగ్గరికి వచ్చి certain IVF specialists want clearance from breast surgeons.
Really?
Yeah, saying that she will not get breast cancer and the lump size will not increase. I don't know how we can give it, because ultimately I cannot give that statement, blanket statement saying nothing can happen.
Are you serious?
Yeah, I keep getting certain references from gynecologists from different hospitals.
Oh, really? Are you serious?
Yeah. So even now, all that I'm going to say is, I'm sure you know this, there is nothing that we can say with certainty. But yes, multiple cycles of IVF, multiple hormone injections, etc. Yes, it can increase slightly the risk
of non-cancerous fibroadenoma.
Breast cancers and fibroadenomas, if you keep continuously injecting hormones over like multiple cycles, the size can probably increase, but that happens even during pregnancy.
But I think it all comes to the counseling to the patients, and so that if she's well informed of what is going to happen to her, the acceptance of is well with the
counseling is what is required, and being honest about what they have to look out for. I think, like you said, those are the important things.
And also, Pragnya, I see young girls, they're very upset about the difference in the size of their breasts. Is it true? Like, will that correct over the time, or are they going to stay, the uneven size of the breasts?
No, they probably will not correct itself. We have to wait until the developmental stage gets over, and no two breasts are the same size and shape, because ultimately they
gross
develop
it's okay, but there are certain girls I see, like you can grossly identify they're uneven.
అది చేయొచ్చు, బట్ ఉంటాయి అలాంటి కేసెస్లో అన్ఫార్చునేట్లీ ఇట్స్ ఓన్లీ సర్జికల్ ఇంటర్వెన్షన్ వేర్ వి ఆగ్మెంట్ ఆర్ రిడ్యూస్ వన్ సైడ్, అంటే ఆగ్మెంట్ అంటే సైజ్ ఇంక్రీజ్ చేయడం విత్ ఇంప్లాంట్స్, ఆర్ that's what we end up doing.
Also, I personally wanted to know, like, augmentation surgery, how safe it is.
It's safe. It's safe because ultimately,
where do you take the augmentation from?
See, the two types of augmentation again. Okay, once we use our own body fat, and the other one is we use implants. Most of these cosmetic augmentations are done using implants. Implants are foreign bodies. That is the first honest truth that they have to understand, and the way the body reacts is very different. Breast కింద పెడతాం అంతే. It's a simple procedure, honestly, to do.
So ఇప్పుడు breast implants ఉంటే when they are bearing a childbirth కి, breastfeeding కి, they wouldn't be a problem.
No, because it's completely below the breast.
Okay.
Right? So generally no. కానీ అది implants మళ్ళీ reductions చేస్తే size వల్ల. When people come to me asking me for reductions, papam 18-year-olds, 19-year-olds, they come to me because of back
reduction,
pain.
Heavy
breast reductions, yes, breast reductions because of
yeah.
heavy breasts, back pain, etc. And sometimes they're overweight and the breasts also increase in size. The only thing I tell them is first try to lose weight, right? Over 6 months, try to lose weight, and then try to finish your entire reproductive cycle, breastfeed, whatever it is that you want to do, and then come back if it still remains like that. Because ippudu ganaka in premarital age group, if we end up doing a breast reduction, I've seen women not being able to breastfeed, which is the honest truth again. It is the honest truth, because we are changing so much. It's very hard to breastfeed after you do a reduction. Again, the type of reduction is different, but it's quite hard to feed because we're changing the anatomy మొత్తం మార్చేసినప్పుడు కొంచెం కష్టం అవుతుంది.
Reduction, not
breast
increasing.
Increasing కి ఇలాంటి ప్రాబ్లమ్స్ జనరల్ గా ఉంటుంది. Breast reduction అన్నప్పుడు ఇలాంటి symptoms ఉంటాయి.
Because of fibrosis that happens post surgery and all.
Fibrosis ఏ కాదు, మనం మొత్తం anatomy నిప్పుల దగ్గర నుంచి మొత్తం మార్చేస్తున్నాం. పైన పెట్టడమైనా పక్కకి వెళ్ళడమైనా. So we're cutting the ducts right below. How is it possible? Unfortunately, counseling sarigga jaraka, they come to me again saying, "E doctor, so and so person did it for me. I'm not able to breastfeed." The other thing that younger women తెలియాల్సింది ఏంటంటే, until you lose weight, until you finish your family, unless it's absolutely dire, like excruciating pain unna alanti symptoms unte kani, don't try to go for breast reduction unless you absolutely need it, because ayanta అయిపోయిన తర్వాత when you lose weight, they become even more saggy, and at that point correcting it is harder.
Okay, so stabilize the weight.
Try everything else before you go for surgery. And I know just this year I think I've sent at least like 6-7 patients away saying, no, go lose weight and then you come back to me. And
how many of them came back losing weight?
4, a fifth one is supposed to come next week.
Determination.
4 of them came back. I wouldn't say drastic weight loss, but they're feeling so much better. Right? So I think it's also counseling that is very, very important in these cases.
Yeah.
మీ దగ్గరికి another patient with these symptoms might come kada, armpit swellings.
Oh yeah. Rightly you mentioned that. చాలా మందికి ఈవెన్ ప్రెగ్నెన్సీలో కూడా they don't know axilla fat ఉంటుంది and there is a breast tissue అక్కడ కూడా. కరెక్ట్. చాలా మందికి ఓపీడీలో వస్తారు కదా ప్రెగ్నెంట్ లేడీస్ కానీ డెలివరీ అయిన మదర్స్కి, ఆల్మోస్ట్ 10లో 3 to 4 will have this complaint. ఏంటంటే ఆర్మ్పిట్లో యాక్సిల్లా లోపల అన్నమాట స్వెల్లింగ్ వస్తుంది. దట్ ఈస్ బికాస్ ఆఫ్ ద హార్మోనల్ చేంజెస్. అక్కడ టెయిల్ ఆఫ్ ద బ్రెస్ట్ ఉంటుంది. సో ఈ బ్రెస్ట్ పెరుగుతుంది. ఈ ప్రెగ్నెన్సీ అండ్ డెలివరీకి ప్రిపేర్ చేస్తున్నప్పుడు ఆర్మ్పిట్ ఒక్కొక్కసారి అది జస్ట్ ఫ్యాట్ కూడా అవ్వచ్చు. యూ జస్ట్ హ్యావ్ టు జెంట్లీ మసాజ్ ఇట్. అది పెయిన్ లేనంత వరకు అస్సలు వరీ అవ్వాల్సింది లేదు. బట్ సమ్ టైమ్స్ ఇట్ ఈస్ రియలీ ప్రాబ్లమాటిక్ టు ఫ్యూ ఉమెన్. I know, but etla we say massage the breast, cold therapies and all that, but
daniki kuda there is a surgical way of doing it depending on the size.
So you will remove the breast.
So we do a liposuction. Chala chinnadi aithe liposuction okate.
If just that
adi okkati liposuction is a good way of it's just fat kada ultimately.
I know, yeah.
So liposuction chesi aa skin ganaka tiyarante there will be a small scar. Depends on the size also. So there are ways to do that if they're very cosmetically inclined. Ante they sometimes it's very ugly papam when it even falls in between their arms. So alanti cases lo cheyachu. And I do get a lot of those patients.
If you lose weight, the axilla fat
sometimes it doesn't go down. Sometimes it doesn't go down.
Chala mandi that also they ask anamata. I lost weight, I'm happy with my weight, but the armpit is saggy and what to be done.
It's a more or less simple procedure, honestly. But ultimately anesthesia kin ellali.
So what I understood after this is anything breast is surgery.
Not really. Breast pain is not surgery. Most of the women with breast pain are symptomatically, there's a symptomatic relief. Unless surgeries unte, that would be amazing, but no. not so many surgeries. Unnecessary surgeries we don't touch.
But I think most commonly also, Pragnya, do you get like breast pain, mastalgia?
Yeah. Around 90% of the clinic is that.
Yeah, like premenstrual mastalgia. How do you deal it?
Premenstrual syndrome. I just reassure
even I get it. I think I'm the first one to see these women.
Nothing. 10 to 15 days prior to your cycles, I reassure them saying this is absolutely fine, and to maintain a breast pain diary. ఆ పెయిన్ గనక కంటిన్యూస్ గా సైకిల్స్ అయిపోయిన తర్వాత కూడా కంటిన్యూస్ గా నాగింగ్ పెయిన్ వస్తే అప్పుడు దిస్ అన్ ఇంటర్వెన్షన్ దట్ వీ కెన్ డూ.
కానీ but do exercise help the breast mastalgia? It will stabilize the hormones and all kada?
Ultimately yes. కానీ most often it's just reassurance and eventually child bearing age group అదంతా అయిపోయిందో తగ్గిపోతాయి. That's but again
అంటే the hormonal shift, the estrogen hormone తగ్గుతున్న కొద్దీ the mastalgia will also disappear. But I also see in the premenopause women also are complaining of this mastalgia.
There's so many hormonal changes that happen kada, and also the breast starts sagging and they don't half of them don't wear bras in the clinic, and that's something that people should do to give adequate support and reduce the pain.
So do you, as a breast oncoplastic surgeon, you suggest people to wear bras?
Yeah. Okay. Absolutely, all the time. And at night there are other softer ones that you can wear. Okay. Especially large breasted women. Because
large breasts, because the sagging untundi valaki. Even I get patients in the OPD with neck pain, you know. That is like with the heavy breasts.
But heavy neck kakunda even medium size or peacock etc. I always advise them to wear because support is very very
Isn't
very
it
essential.
Most women are not comfortable wearing bras?
But you can wear different kinds kada. There's sports bras and there's so many different things that you can.
Sports bra because the corpus ligament needs support. But you advise them even while sleeping?
No, sleeping is okay. Sleeping while, see, if they want to, they can wear comfortable ones. If not, they can remove. But while they're during the daytime doing their normal household chores or work, etc., in fact, they should wear it. And one more thing, like, you know, recently I've been reading a lot about this because clinic law, they come saying pain. There's no other issue. Vitamin D will be in very, very low. Get that sorted, pain will reduce. And it's incredible.
The one hormone any woman needs to be tested is vitamin D.
It's incredible how vitamin D changes the pain structure for a woman.
But what does the study say, Pragnya?
Vitamin D,
the bra and women?
You should wear it. You should wear it. There's no breast cancer risk or anything like that. So Shruti, చాలా మంది నీ దగ్గరికి I'm sure they even come with family history of multiple cancers, like with breast cancer, ovarian cancer. So how do you counsel them, and how many patients do you see in the clinic like this? Just a family history.
Out of 10 women, 2 will come up.
Okay.
But actually they don't point out anamata exactly idi, like you manaki telusu as doctors breast, ovarian and intestine are linked ani, but they'll say some history of cancer. I'm worried. It could be ovarian, it could be uterine, it could be breast, anything. So atla multiple family histories to vastaru, and that does haunt women a lot anamata. I need to sit and ask exactly edamma ekkadundi enti anedi, because ippudu family history of ovarian and breast ante manam
HPOC
and BRCA is also costly. It is not like very easily affordable kuda kada.
But you know, alanti cases lo what I've started doing is obviously taking a detailed history, and if I think there's something suspicious, I'm sending them to genetic counselors, because genetic counselors మొత్తం family history తీసుకోవడమే కాకుండా they'll even suggest if అంటే test చేయించుకుంటే what are the pros and cons. Test change kapote what are the advantages and disadvantages, because our mindset undali direct ga test cheseskunte anxiety valla it's very hard for the patient to, I mean not the patient, the person to take
the woman to take it,
you know, it's not only women, even men do this.
This is okay for the cities like Hyderabad, but tier 2 cities is the problem when you practice in tier 2 cities.
Absolutely, it's not that easy. It's not that easy. But thanks to COVID, we have video consults today, and most of us are getting into that as well. So you know, the strong history unte, I think.
So ఇప్పుడు మనకి ఫ్యామిలీ హిస్టరీ ఆఫ్ బ్రెస్ట్ ఆర్ కోలాన్ ఆర్ యునో ఓవేరియన్ క్యాన్సర్ ఉంటే వాట్ ఈస్ ద ఫస్ట్ టెస్ట్ యూ వుడ్ సజెస్ట్?
నేను చెప్తున్నాను కదా, థైరాయిడ్ అయినా కోలన్ అయినా ఫ్యూ బినైన్ కండిషన్స్ కూడా ఇంటెస్టైన్ లో లేకపోతే బ్రెయిన్ లో ఏదైనా ఇష్యూస్ అయినా I put together the family chart, and the first thing is I have like a basic idea that this can be this and this. Kani sending them to a genetic counselor is so important because one, they're the experts in that field, and second, pre-test, post-test counseling and untundi. That is important before you subject them to a test. Ippudu there's so many clinics that, you know, ultimately just do a blood test, comprehensive genetic panel ani. Change kodam anta kashtamem kaadu, but what are the repercussions? How does the person feel if they turn out to be positive? It's not something people take easy.
I know.
So I think
the test comes positive, but we actually can't do anything about it, and you have to live with the idea of this, and it does affect you a lot.
It's not easy. It's not easy at all. So I think adequate counseling is extremely important.
But if family history of breast and ovarian unnappudu, what is the one test other than BRCA, BRCA 1 and 2?
Ee women lo I do BRCA 1, BRCA 2 are the most common things that we do get tested.
But ఇప్పుడు ఇది టెస్ట్ ఉందంది కదా ప్రజ్ఞ, how many in your clinic you have seen prophylactic గా అంటే రాక ముందరే how many of the young women actually underwent you know removal surgeries?
The few people, I wouldn't say like maybe
అంటే acceptance ఎట్లా ఉంది?
3 out of 10 they would,
even though they are positive, getting it done అవ్వకుండా ఇంకా ఆ మైండ్ సెట్ ఎట్లా ఉంది?
You know, I would still say 2 out of 10.
I
would very low,
2 out of 10 positives.
For example, 10 positives, only 2 get surgeries done, like prophylactic surgeries. Chaala mane they opt for surveillance, right? And here I'll be very honest about the fact, and it's actually quite interesting, and I told you about this kadintak mundu, my entire family is BRCA positive. Right?
And I really appreciate you, you know, to coming out and telling the story of yours.
Something that had to be done.
I know.
Kani, the point I'm trying to make here is I went for surgery. My sister chose just wait and watch because she had a kid, and now she'll take some action against it, and she's 37, but she still waited, and obviously a lot of anxiety going on. And then my mom, who just opted for surveillance of the breast but got her ovaries removed at the right time. Right? So family lo unna vallane I never pushed, so I don't push anybody.
Exactly.
Right? It's up to them. I chose a mastectomy for other reasons.
But you make sure they're well informed of whatever it is.
That's all I keep propagating. Understand your risk and then do what you want.
మనం చేయలేం. ఇప్పుడు ఎవరు వచ్చినా కూడా IVF లో కూడా this is it, image is this one, sperm quality is this one, this is your option, these are your options, option 1, option 2, option 3. We can't suggest or direct them or force them anywhere. So we can never do that because we don't like to be forced, isn't it?
You know, very few patients, it's not about, you know, doctor shopping or something. A doctor who sits and talks to patients is all that they need. Like, you know, sits and counsels. Idi kuda
Pragnya, like how do you, like I'll do whatever is necessary to the couple, but at the same time this doesn't go well when you are seeing a lot many more patients. అదే కదా, see మీ ఇంపార్టెంట్ ఏంటి అనేది మేము చెప్తాము, బట్ అక్కడ కూర్చొని we don't really chat, isn't it? Taking how you, fine, a bit of conversation is okay, but this is the situation I face in my OP. Like I can't give an entire hour and ask which movie you saw, was that real good and all this, isn't it? So that is what I think the newer generation patients also should understand. You're going to the doctor to get treated. You know about your condition. You're not going there to have a just chit chat or whereabouts about yourself and the doctor, isn't it?
I'm sure you're doing a great job at that, because that's the reason you have the number of patients that you do who love you. But you're right. You know, it's not always about doctors looking out for something from that patient to get a case or to get some investigations. It's not always that. It's also about how doctors do get connected to the patients. And initially when I started my in Hyderabad, started practice in Hyderabad, I used to counsel patients thoroughly, like 45 minutes, 1 hour. And then they used to go doctor shopping initially. Appudu asal my heart used to break. I used to come back home and I used to speak to everyone.
We all face that situation.
Exactly. Now I'm more used to it.
Yeah.
Now I'm more used to it. It's okay, whatever.
Over
they get
the years,
tested.
yeah.
Guilt conscious anedi ledu, but
I
then
know.
oh my god.
Even initially, I was there. I really connect to that. For a normal delivery, I have to sit and counsel the mother, grandmother, the husband.
What's that again? Normal deliveries and C-sections. Is it true?
What is it?
Is it true that C-section rates have increased drastically compared to normal deliveries?
It's not drastic, Pragnya. It's been always, ఒకటి అందరు అర్థం చేసుకోవాల్సింది ఏంటంటే ఒకప్పుడు ఉమెన్ ఏంటి వాళ్ళు అన్ని పనులు చేసుకునేవాళ్ళు, ఇంత కేర్ ఉండేదా? ఇప్పుడు ఆఫ్ లేట్ హౌ మెనీ ఉమెన్ ఆర్ యాక్చువల్లీ టేకింగ్ కేర్ ఆఫ్ దేర్ హౌస్ హోల్డ్ చోర్స్ అండ్ ఆల్ దట్? Most of them have diversified their jobs into IT professionals, and the woman, the job is shifted to an entire thing. And adi kuda obesity also ఎక్కువైంది, the mobility also ఉంది కదా. సో మనం అప్పుడు కూడా ఏమయ్యేది, మీరు డెలివరీ అయితే డెలివరీ అయ్యేవాళ్ళు, బట్ పెరినేటల్ మార్టాలిటీ అండ్ మార్బిడిటీ వాజ్ ఆల్సో మోర్. నో వన్ ఇస్ టేకింగ్ కేర్ ఆఫ్ దాట్. ఒక మదర్ డెలివరీ అయ్యే వరకు ఇన్ఫాక్ట్ ఒక జన్మ అనేవాళ్ళు, బికాస్ ఎనీథింగ్ కెన్ హ్యాపెన్. మెడికల్ ఇది ఉండేది కాదు. బేబీ బయటకు వచ్చే వరకు మనకు తెలియదు, అండ్ మదర్ డెలివరీ అయ్యే వరకు కూడా మనకు తెలియదు ఇఫ్ షీఈస్ దేర్ ఆర్ నాట్, ఇఫ్ షీఈస్ గోనా స్టే అలైవ్ ఆర్ నాట్. ఇప్పుడు మెడికల్ కేర్ హ్యాస్ ఇవాల్వ్ సో మచ్. ఐ థింక్ ద మోటివ్ షుడ్ బి హెల్తీ మదర్ అండ్ ద హెల్తీ చైల్డ్. అండ్ డెలివరీ అయ్యా వరకు లాస్ట్ 5 minutes వరకు కూడా వీ డోంట్ నో విచ్ మదర్ విల్ పుష్ విచ్ బేబీ. సమ్టైమ్స్ అ స్మాల్ బేబీ వోంట్ కమ్ అవుట్, సమ్టైమ్స్ 3.5 kg బేబీ విల్ కమ్ అవుట్ గుడ్. అండ్ ఇక్కడ ఆబ్స్టెట్రిషియన్ ఎంత టెన్షన్ లో ఉంటారు, అయితే ఒకటి అవ్వకపోతే ఒకటి. అండ్ ద వర్స్ట్ పార్ట్ ఇస్ అవుతుంది అనుకున్నప్పుడు కూడా లాస్ట్ మినిట్ లో, బికాస్ ఆఫ్ ద బేబీ హార్ట్ బీట్ మానిటరింగ్ సిస్టమ్స్, వీ నీడ్ టు బి మెడికో లీగల్లీ ఆల్సో వెరీ సేఫ్ కదా. వీ నీడ్ టు గివ్ ఎ హెల్తీ బేబీ.
Yeah, absolutely. A lot of things that go into
and no that. one in today's generation is going to accept if the baby turns out to be bad.
There'll be a lot of medical legal issues. Medical legal issues ante gurtochnayi. I have to ask you about this. This entire clinic recently, the fertility clinic, the entire scandal that was surrounding it. What was that?
So much of scrutiny that is happening. It's like a black sheep in any field, Pragnya.
But this is beyond a black sheep. This is like horrific.
Yeah, but how are we responsible?
No, not
to...
you.
Yeah, not me. You, but how are the other doctors, who are facing in and out?
They aren't.
Now, the couples are also taking a lot more time to trust a fertility clinic. But they should understand it cannot be done like that. Now, everything is so open. If without the consent of the couple, the husband and the wife, their photographs are also taken into consideration, their marriage certificates, everything is properly monitored and documented. And mata donors ante we can't just take anything like that. We have to operate through the bank, and everything is open. You can know about your donor, you can know about your sperm, you can know everything. And ఒకటి నాకు అర్థం కాదు, ఫర్టిలిటీ అంటే ఎవరిదో వేసేస్తానంటారు. అరే మీరు మెడికో లీగల్లీ a doctor is responsible kada.
So Shruti, there are two questions again that I was thinking. In terms of breast cancer also, younger women I sent for egg freezing. Okay, prior to starting the chemotherapy, etc. That is one question. And unfortunately, increase in the number of women, this is an option that they would want to take. Adokati. And second ఏంటంటే చాలా మంది again IVF ki. Natural conception అనేది చాలా తగ్గిపోయింది. And IVF anedi, why is so many women, like couples, opting for fertility treatments?
So egg freezing recently chala controversial kuda ayindi kada. Our dear Upasana said it in the benefits, in the best interest of the woman, but there were people taking it in wrong perspective also. Meeku asle you don't know, ippudu nenu fertility clinic lo కూర్చొని scans చేస్తుంటే అసలు 25-30 years ki kuda it is shocking. It is really shocking. I hardly see follicles anamata. We don't know, is it because of the lifestyle or because of the stress that woman is going through in this generation? ఒకప్పుడు మంచిగా ఏం చేసేవాళ్ళు, ఇంట్లో కూర్చునేవాళ్ళు, ఫైనాన్షియల్ ఆస్పెక్ట్ వాళ్ళకి అసలు పట్టించుకునేది కాదు, ఓన్లీ పిల్లల్ని పెంచటం, ఇంట్లో ఏం కావాలి అనేది చూడటం. అది అసలు చాలా ఈజీ అనుకుంటా. ఇట్ ఇస్ నాట్ ఈజీ, దట్ ఆల్సో నీడ్స్ అ లాట్ ఆఫ్ థింగ్, బట్ అంత స్ట్రెస్ ఉండదు కదా. ఇప్పుడు ఉమెన్ ఫైనాన్షియల్ ఆస్పెక్ట్, కెరియర్ ఆస్పెక్ట్, ఫ్యామిలీ బేరింగ్ ఆస్పెక్ట్, ఇవన్నీ ఐ డోంట్ నో వాట్ ఈస్ ఎగ్జాక్ట్ రీజన్, బట్ ఓవేరియన్ ఫాలికల్స్ క్వాంటిటీ అండ్ క్వాలిటీ తగ్గిపోతున్నాయి. ఇప్పుడు ఉమెన్కి కెరియర్ చాయిసెస్ కూడా పెరిగినాయి కదా. She might not have met the right partner, and she wants to grow in her careers and all that. So it is never like ఇది ఉంది మీరు పెళ్ళిళ్ళు చేసుకోకండి, మీ ఇష్టం వచ్చిన టైంలో చేసుకోండి కాదు. In case you are a woman should not be forced because of her fertility అన్నమాట. సో ఇఫ్ నీ ప్లాన్స్ ఏమన్నా డిఫరెంట్ ఉంటే ఇది జస్ట్ లైక్ అన్ ఇన్సూరెన్స్. ఇట్స్ లైక్ ఎ ప్లాన్ బి. ఇఫ్ ప్లాన్ ఏ డజంట్ వర్క్అవుట్, మనకు అసలు ఏ ప్లాన్ లేకుండా ఉండటం కంటే ఎగ్ ఫ్రీజింగ్ ఇస్ యువర్ ప్లాన్ బి. ఒక సెన్స్ ఆఫ్ సెక్యూరిటీ కూడా వస్తుంది. ఇట్స్ నాట్ లైక్ మీరు ఇది దే ఆల్సో పాయింట్ అవుట్ అన్ ఇన్స్టెన్స్ వేర్ ఒక ఆవిడ షీ ఫ్రోజ్ హర్ ఎగ్స్ ఇన్ హర్ 30s, అండ్ వెన్ షీ వాంటెడ్ టు యూజ్ the eggs were of very bad quality. That is, again, you have to take your choices. That can happen, but at least you are having your eggs or embryos kada. So, and breast, whoever is going for any surgery, chemo, radiotherapy, young girls should think వాళ్ళకి ఇప్పుడు ఆ థాట్స్ ఉండవు, బట్ ఫ్యూచర్ యూ డోంట్ నో వాట్ ఇట్ ఈస్. సో ఎగ్ ఫ్రీజింగ్ ఐ వుడ్ డెఫినెట్లీ రికమెండ్,
especially because the quality completely gets compromised with chemo and all the other medication.
Women are not the same. Like you see, in 6 months a lot many dynamics can happen and change. నేనే షాక్ అవుతాను. ఒక 6 months ముందే చూసిన ఉమెన్ కి AMH and the quantity of the eggs, నేను 6 months నా స్కాన్ రిపోర్ట్ నేనే చూస్తే it's drastic.
ఇలాంటివి we also see in women who are extremely physically active, exercise wise, and good lifestyle. Avanni unna kuda this is falling. So it's kind of surprising. So a woman should really not believe that.
As this generation millennials, I would definitely recommend, if I would have to advise my daughter in future, definitely I will advise her. That's of course her choice.
So I guess the takeaway would be, ఎంత ఫిట్ గా ఉన్నారు, ఎంత గుడ్ లైఫ్ స్టైల్ మెయింటైన్ చేస్తున్నారు అనుకున్నా కూడా, based on your biological age, you should take a call.
Do it when you can do it. And don't regret it later. You shouldn't regret later.
That's pretty much the reason why fertility issues are happening.
And also late marriages, lifestyle. ఒకప్పుడు 6 యాక్చువల్గా అయితే 7 o'clockకి పడుకొని 6 o'clockకి లేచి ఇంటికి వెళ్ళి మంచి ఎన్విరాన్మెంట్లో, దట్ ఈస్ హౌ ద ఎన్విరాన్మెంట్. అందరూ పల్లెటూరులో ఇది. నౌ వీఆర్ ఇన్ ద సిటీస్ విత్ ద హ్యాజల్ వర్క్. ఓ మై గాడ్, హౌ మెనీ us are actually sleeping at 9 o'clock.
So future plans,
I hope we recently started the fertility center in Hyderabad. Hope it solves all the problems of many more women, and I hope they see a lot more happiness. I see a lot more happiness in many more families in the form of the babies.
That's fantastic. I know
it is affordability also to all the genres of women.
Bringing a baby into this world, it's another high. It's a high. I've never, honestly, I was never inclined towards obstetrics and gynecology ever.
I know you.
But when I had my own children, I saw the obstetrician's face, and I'm just like, wow. You guys are gods, the way you just bring
but obstetrics, if you don't take it if you don't love it.
That's the same thing with general surgery. Unless you are a hardcore built surgeon, don't get into it.
I know.
That's pretty much with any field, I guess.
You can choose whatever field, but be passionate about it, and you'll see heaps of success. I think so. Because ultimately you go back to your home or your bed, you should feel happy that you've done the right job and you are doing something.
Nico, the way you feel so happy about delivering a child. For me, it's not only the surgical clinical work, but the foundation that I run. The foundation that I'm running.
You are doing a fantastic job, Pragnya.
No, it's just a different high, helping these women get detected, rural India, and then trying to help them financially.
The foundation, and I have seen the what was that? The caravan.
Yes, it's a bus. It's a mammogram bus
Uh-huh.
that goes to rural India,
Mm-hmm.
and it screens women in different villages. So we've,
Okay.
I wouldn't say adopted, but we've taken up Machel district right now, and we're working on all the women there. We finished around 5,300 women so far.
How many
And
actually came out to be?
Around 12 women
Oh,
were detected.
That's nice.
Lots of confounding factors. Ante chaala mandi, like, you know, women, again, మీరు ఇందాక చెప్పిన taboo వల్ల
They don't
రారు.
want to talk.
వచ్చి కూడా వచ్చినా కూడా లైక్ బ్రెస్ట్ అంటే వద్దు, నేను వేరే బీపీ చూడాలంటే చూడండి అలా అని
కానీ
వెళ్ళిపోయే వాళ్ళు కూడా
ఒకప్పుడు
ఉన్నారు.
అంత ఫీమేల్ డాక్టర్స్ ఆర్ నాట్ దేర్ కదా ప్రజ్ఞ. ఐ థింక్ నౌ విమెన్
This is an all women's team. This is an all women's team
that
that
is
goes to
more
these clinics.
even
అయినా కూడా it's
better.
not. But again, that's rural India for you.
And
right?
I think women also, if any problem or the lump they come, they don't feel nice to discuss maybe. Or to accept also. That's the problem. She would have come earlier. You would have done a better job, and she should have been
yeah,
early.
we could have saved lives.
Done a lot.
Alani, this foundation also helps a lot of women, not only with cancer issues financially, but even benign. Sometimes they're like, these, you know, women from financially very hard backgrounds, and they don't have finances to fund their fibroadenoma surgeries, filled surgeries, and none of these government schemes actually cover those.
Oh, really?
Yeah, they
Okay.
don't. And sometimes cosmetic surgeries in certain women, until like, you know,
Cosmetic surgery, yeah.
they don't cover them. But this foundation, what I've done is I've anything with regards to the breast, but I have a set of 4 board members who have to accept that case, including a doctor who's a breast surgeon along with me. So both of us say this is required, because cosmetic ante evaraina vachi నాకు reduce చేయమని చెప్తే నేను తీసుకోను. If there's an issue, if it's post-pregnancy issue, something like that, we do help them. And phyllodes can kill you at some point.
Yeah.
So those kind of patients also we're helping, and hopefully let's see how this goes.
Yeah, I'm sure it goes great.
Yeah, that's pretty much it.
Because the intention behind that is really great, and yeah.
Well, thank you.